Have you ever wondered what it would be like to think like a pathologist? Like, what? What are you talking about, Bruce? Pathologists really have this great thing. They're able to do pattern recognition. What if we could see patterns and learn from patterns just like the pathologist sees it when in during their work? Hi, I'm Bruce Spurlock. I'm a physician and healthcare leader committed to helping decision makers and leaders navigate change with clarity. At Viral Healthcare, we examine the trends and ideas spreading across healthcare and how to implement them effectively and sustainably. So today's reflection is going to be on this concept of pattern recognition. In other words, we're going to try to see if we can detect lessons or patterns from some of the trends and some of the ideas that had transformational, permanent change in how we cared for people in the healthcare system, and others that promised a lot but were maybe more incremental in nature and their success factor. It's kind of an important topic to think about, to compare and contrast, and then learn from some of these lessons. So let's take 4 practices that we talked about on our podcast on Tuesday that have really dramatically changed how we care for patients, and we don't even think about it anymore. They're so embedded in how we do it. The first one was minimally invasive surgery. I mean, those were the days before we had laparoscopes and other practices to be able to fully open people up completely, and then it was painful, recovery was long, and they were out of work for weeks at a time. And then minimally invasive surgery came along. We don't even think about that again. How about HIV antiretroviral therapy? I mean, I was there when the HIV and AIDS epidemic started and took care of a lot of patients when we didn't have anything but hope and a way to alleviate symptoms to make them comfortable and not to cure the disease. And now we don't even look at it as a death threat anymore. People have normal, regular life expectancies and regular life patterns because of it. How about point of care ultrasound? This was the days, back in the days where you had to get an ultrasound tech in, and then they had to do the procedure, and then they had to send it to a radiologist, and a day later, 2 days later, you might have heard the results. And now we have it at the bedside. We brought this idea of making diagnosis real time to the bedside, and we trained people along. And I don't think anybody would want to even go back to those old days back when I was practicing. And the last one was NICU advances. And it wasn't just one kind of thing, it was a collection of things that built on each other that over time went from a success or survival rate in the NICU in the 60s of about 5% to reaching 90% nowadays. So dramatic change is happening, very transformational in nature in how we implemented those. Now compare them with 4 examples that promised a lot but didn't quite deliver. Things like precision oncology tumor boards. You might remember hearing about this. We had all these cell markers. We had all this way to talk about individual DNA activities, and we were going to have precision tumor boards that were going to refine exactly how the practice of oncology should go forward. And it's starting to come out now, but really those have largely been abandoned because it's just not that common that we can see that have that many different types of therapies to do it. The second one is blockchain. Yeah, this was a big deal about 10 years ago. And even as late as 5 years ago, people thought blockchain was going to change how we do medical records, how we share information, and blockchain is nowhere. It was on all these conferences, but it's now nowhere. How about virtual reality? I just saw an advertisement for virtual reality. It's still something that's out there, but remember the promise that they had just 3 or 4 years ago was all these patients with anxiety and depression were going to do it and have cures, or people that had chronic pain and other diseases that had chronic symptoms that dragged people down. Virtual reality was going to be the process, and it just didn't scale. I mean, a few small pilots that showed some impact, but it hasn't gotten a lot bigger, partly because of the cost and the inconvenience and the difficulty getting it to the right patients at the right time. So that one hasn't. And the fourth one is Haven Healthcare. You may not even remember this, but this was a big announcement by Amazon, Berkshire Hathaway, and JP Morgan, 3 giants that had a lot of money, a lot of resources to put at how to disrupt healthcare. And then like a couple of years later, it just quietly disappeared. And it really shows that healthcare is super complex. It's got national but local categories to it as well. And just throwing resources at trying to fix healthcare is not the solution. All right, now it's time to act like a pathologist. So let's look at and think about what were the success factors that were common for all 4 of the examples that we showed today. And the first part of it, it was a problem first. It was something that started off with, we have this major issue that we have to resolve, and we're going to find the solution rather than get the solution first part of it. The second part, there was strong evidence that it worked. I mean, it wasn't just in a couple of small pilots. It was after study, after study, after study. It was years of studies. And so the evidence sort of drove some of the adoption for it as well. It wasn't weak evidence. It wasn't controversial evidence. It wasn't small scale evidence. The third part, it was relatively easy to integrate into the workflow. So workflow integration was important. Fourth part was there were sustainable economics. In minimally invasive surgery, the surgeons won, the hospital won, the patients won. And ultimately the employers won because patients came back to work. So sustainable economics make a big factor of it. And finally, there was improvement over time. It didn't just stop at the first thing. We started looking at minimally invasive surgery in different parts of the body. It starts off as cholecystectomy and appendectomy, and then it works into lots of other places where we can use those tools and that technology. So it improved. In the NICU, there were multiple activities and multiple different interventions that improved over time. So those are the parts about transformational. It's not one single big bang disruptive kind of thing. How about the things that sort of identify the incremental parts? Exciting technology, super, super exciting technology, or very, very strong marketing. Lots of announcements, lots of marketing dollars put on them. Big expectations. This is the words transformation come out, whereas in the other areas, nobody talked about minimally invasive surgery as a transformational thing. Nobody talked about POCUS as how we're going to transform medicine. They just did that, and they didn't need those kind of words to do that. So every time you hear that word transformational, it makes me a red flag go up. They had limited implementation. I mean, and it like was one or two areas. It wasn't reflective of broad time after time, study after study implementation, like the virtual reality was a good example of that. And finally, it had a weak operational fit. I mean, people had to go pick up the virtual reality things, deliver them back. It was very awkward on how to do that. So that's the things that are important to think about from the pathologist viewpoint of what interventions and ideas do actually transform and which ones are incremental. So here's the question I want you to do. The next time you think about implementing a new intervention, a new topic, think about what problem are we solving? Ask yourself that question. What problem are we solving? And is it our problem? Or is it somebody else's problem that they're trying to make our problem? Who benefits? It's a really big question of who benefits. Does a vendor, does another party benefit at the expense of somebody else? Can it scale? And realistically, can it scale? And what will you think about in 10 years? I mean, will we not even worry about a Haven Healthcare, or will Haven Healthcare sort of be the only one doing it? Finally, I would say if it's bottoms up, if you hear about this from your staff, from the people actually doing the work, it's got a good chance of having some kind of an impact. So that's my story today. I hope you enjoy it. For our next session on Tuesday, we're going to be talking about what are effective ways that leaders can communicate new ideas or innovations when they want to implement them. So this is about communication and how you should be talking, what things you should do and what things you should avoid in thinking about implementing a new idea. And with that, I'm Bruce Spurlock. If you enjoyed this session, tell a friend about it, share your ideas with them, share your ideas with me. Find it on all of your podcast platforms, and we look forward to seeing you again. Thank you very much.